Now very briefly about dermis and subcutaneous layer. The dermis is considered a part of integument. It is a layer located under the epidermis and closely connected. This is epidermis, this is the dermis layer, and connected to the epidermis. It's mostly connective tissue, so it cushions the body. And it contains, if you look at it, it contains a lot of structures. So first of all, there are blood vessels, because you remember the epidermis doesn't have blood vessels. So all the nutrients and gases should come with the blood vessels that under the epidermis, in the dermis layer. It also has hair follicles. That's where hair grows out. It has muscles that are associated with hair follicles. It has numerous glands, like here there are oil glands, sebaceous glands. This is the sweat gland. And also it has multiple receptors. Receptors that sense the touch, sense the pain, sense the temperature. So all these structures are located in the dermis. Just to show you the variety of receptors that present in this layer of skin. Again, you don't have to know them, but I want you to see the diversity of them. So there are some free nerve endings that's sensitive to temperature and pain. There are Merkel discs that respond to touch and pressure, and also these Krause and bulbs. There are Pacinian corpuscles that respond only to like sudden disturbances, like vibration. There's some receptors that sense how the hair bent. There are some receptors that sense the skin stretch, and they are especially important for controlling the position of the fingers. And there are some receptors that's sensitive to only to the light touch. So the variety of these cells provide all the range of the sensation that we have in our skin. Another two things that I wanted to mention when we talk about the dermis, and one of them is tattoo, because tattoos stay for a very long time because the ink is injected into the dermis, not in the epidermis, because the epidermis, the cells move upward and they leave the skin, they slide off the skin. When the ink goes in the dermis, it doesn't go anywhere, it stays here, and it can be used to draw all these beautiful pictures on the skin. And the second is the stretch marks. This is also kind of the work of the dermis, because it's a connective tissue. It has long stretches of collagen fibers in it, and if these fibers break, that's what creates the stretch marks of the body. So even if it's kind of under the top layer, the reason for the stretch marks comes from the dermis. And then we have the subcutaneous layer, again, which is not a part of the skin, but we should look at it together with the skin functions, because it attaches skin to the underlying bones, muscles, and also supplies it with the blood, with the nerves and blood vessels. So this is the layer, it's called subcutaneous or hypodermis, under the dermis. So what else you can see here, this whitish tissue, this is a fat tissue. This is a normal body, a normal place for the body fat to accumulate. So when it's in the subcutaneous layer, it serves like any fat cells, it serves like an energy storage, but also it acts as a padding and a very good insulation for the body. So if you have a little bit of fat under your skin, you won't freeze that fast as a really thin person. Also, the organization of this, or the existence of these three layers, is used in the classification of burns, because again, you heard it multiple times. That's a first-degree burn, or somebody suffered a third-degree burn, And this is determined by how many layers are affected by and what layers of skin are affected by the burns. So the first degree burns are superficial, and they usually only involve the epidermis, so the very top layer of the skin. They're characterized by redness, by pain, by swelling a little bit, like a maybe mild sunburn is typical first degree burn. And they heal fast and they don't leave the scars. So only the very top layer, the epidermis. Second degree burns involve both the epidermis and dermis. These are much more severe. The skin is blistered, they are very painful, and you should not, if it ever happens to you, try not to break the blisters, because once you break them, that opens the route for the infection. And of course, they take much longer time to heal and might leave some scars. But the most severe are third degree burns. They involve all three layers. So they involve the epidermis, dermis, and subcutaneous layer. All of them are destroyed. Third degree burns, as I say, the major concern when the burnt area is high, the major degree is dehydration, because the skin no longer keep the moisture inside the body. They require hospitalization, and if they're severe, there should be, like, to correct sometimes the doctors do the skin grafting, so they take the skin from different part of the body and then put it on the place of the burn. So restoration of these areas is rather limited, and they usually leave a lot of scarring. Okay, so next we'll do the accessory structures in a minute.